For any of you newcomers, I'm Nate Heilman, and we're talking about acupuncture and herbal prescription correlated, okay? So I figured we'd dispense with the intro, because we look very similar crowd. All right, so we're talking about the lung channel, and the red highlighted points are the ones that we're going to spend some time talking about in the next half hour here. And this stars a couple of our own creatures near and dear to our heart. We've got Minu on the left there, and we've got Mr. Blue the Brave. We always have these little voices that we do for our own animals, right? Like, oh, Giles and I, my son, were always like, oh, don't hurt me, I'm so sorry. Mr. Blue's always like, I'm sorry for being alive. Says perfect though, because as I was photographing him, I would just put him in a position and he would just be like, oh. So, and you'll see that in the images coming up here. He's such a cream puff. But this is him doing his best sage impersonation here, wistfully looking off in the distance there. And so we're going to talk about Zhongfu, or Middle Palace. And the location is in the first intercostal space medial to the greater tubercle of the humerus in the superficial pectoral muscle. The Neijing referred to this point as Ying Zhong Shu, point at the center of the chest. Then we have that bow and arrow, that sort of center, Zhong, and then the Shu has this connotation of transport or a boat, or also a cave, which is interesting. So these acupuncture points were thought to be depressions, these caves where you could sort of access energy. Translations or uses for this point are numerous, but it's important to keep the zhong in mind, zhong being the middle. So reconnect an injured grieving to the macrocosm. And that's true of a lot of these points that are on the upper aspect of the body. There's this heavenly influence. If you're needling a point here, you're thinking about the heavens coming in here versus the earthly influences on the lower limb. Treat shoulder pain. Address middle burner fu organ pathology, okay, i.e. stomach pathology. Inside storage of material goods gone awry. So you have vomiting, nausea, belching, overfullness, food stagnation, and heat. You treat an overly verbose, indiscreet person who's vomiting up information. Okay? So that's sort of that. Well, moving on. Can I put a couple needles in you, ma'am? Wind invasion blocking the downward movement of qi. And that's interesting because it has a reference to these pictographs are not only talking literally, but they're talking figuratively. And one of that is the inability to look downwards in these pictographs of Zhongfu. So a wind invasion, if you think about what you have to look down, is a supple spine, a supple neck. If you can't look down, then you have a wind invasion stuffing up your Tai Yang, your bladder channel. Treating entry-exit blocks of the liver and lung connection. Okay? Treating lung and spleen pathology because those two channels meet, which we'll see in a moment. Use this point to purge heat and excess from the chest. Again, it is an alarm point, right? So if you have accumulation of dampness and phlegm in the chest and you needle this point, you're releasing that. So note, the number one use of this point is to treat pathology of earth, digestion, and the middle fu, the stomach. Secondarily, treat the metal pathology, the lung. So I'm sorry if anyone wanted to do that, but okay. So correlating the acupuncture with herbal prescription, if we have an excessive pulse, rapid, rolling, broad, slippery, slapping, maybe even has a little bit of tone and is superficial, and you needle this point and it moderates to something that's slower, softer, fuller, and even, sort of comings and goings in this that would be your less obvious pulse, then you're having some success there, right? So which herbs excel at dissolving middle burner qi obstructions? Pinelia, Ban Cha, and Chen Pi. These are the two cured herbs that work their way into a lot of phlegm-moving formulas. And so air chen tong is 2 cured herbs decoction. And we see the formula, it's very simple. It's actually for a slightly chilly patient that has this phlegm obstruction. So we have Pinellia and citrus working together. We have Poria, Fu Ling, that gently supports the spleen, licorice that's sweeter that supports that, ginger, which works very well in conjunction with Pinellia. Those two herbs were combined in history because ginger detoxified raw Pinellia. Now that Pinellia is cooked, it's very safe. And then Chinese date, which adds an additional blood tonic. So you look at this, you say it's really about tonifying the spleen qi and then moving some phlegm. So it treats vomiting, coughing, and poor digestion due to lung and spleen dampness with a cold pattern. And the acupuncture that you would use to facilitate that, bladder 13, which is the shu point of the lung, bladder 20, which is the shu point of the spleen, stomach 40, which clears phlegm, and lung 9, which tonifies the lung qi. This guy was out late honky-tonking on Broadway. And when there is excess causing food stagnation characterized by oppression of the chest and diaphragm, epigastric fullness and pain, acid regurgitation, indigestion, nausea, vomiting. This is sort of the, and belching. This is sort of that excessive guy formula from Zhu Zhenhong, one dose Zhu, they called him. He was so accurate with prescription that he could heal. I love that. It's just such a gunslinging name, right? I think I'd whip out this vial and heal you with one dose. But he came up with this formula called Yuezhu Wan, or escape restraint pill. It's really talking about blood, heat, dampness, phlegm, and food stagnation in the body. So it just has cypress, which is a strong liver qi mover, ligusticum, which dispels a little bit of wind and moves qi and blood, gardenia fruit, which is very cooling in all 3 burners, but in the middle burner as well. Black atractylodes vents some wind, but it really fortifies the spleen and drains dampness. And then you have shenku, or massa fermentata, which is fermented leaven. That really helps dissolve that food stagnation, and it helps promote digestion and harmonizes the stomach. Oftentimes when you have a patient that has really weak digestion and you're thinking about other methods to sort of prop up their digestion with probiotics or fecal transplant, you can use shenku and shanja, crataegus and fermented leaven. That's a pair of aces in Chinese medicine. They work very well in digestive formulas to help ramp up digestion. So this was formulated. This guy, by the way, Zhu Danji, came up with Air Miao San, which later became 4 marvels. So 2 marvels to 4 marvels came from this physician. And this is Ho Shang Shengqi San, and I've been told that I get really excited when I say the word Agastache. So it's very fun to say. I had to do that for one of the participants here. But basically, Korean mint is what Agastache is. And Korean mint has this venting quality that optimizes movement through that middle burner. This formula is long and extensive, but if we focus more on the right-hand column, it's basically saying that Agastache, Angelica, and Perilla have this aromatic quality that dispels dampness and wind, vents pathogens from the body. Magnolia bark, there's that phlegm mover. Pinellia and citrus, more about descending stomach qi, so that's a powerful down-bearing action there. White atractylodes and poria tonify the spleen qi, and then you have ginger, jujube, and licorice, which harmonize that formula. So it's really a lovely formula to correct, right? It says that zheng is correct qi, so it's Agastache to correct the qi downwards powder. Rhubarb is included here. That's part of some commercial preparations. And rhubarb is an herb that homes to the Yangming. It basically gets in there and moves circulation. It clears heat and has a nice down-bearing action. So it treats a wind damp cold or wind damp heat, often used for wind damp cold invasions in people, often used for wind damp heat invasions in animals, of the gastrointestinal tract, so yang ming layers. An inability to bend the spine, to look down. Think about this formula if you concurrently have gastrointestinal problems and spinal pain. So what does that look like? Dachshunds, right? Dachshunds oftentimes have gastrointestinal inflammation, and if they have spinal pain, you can't put them on dexamethasone because you're going to just rip through the gut. So this is a great formula. It's a great, we have a lot of our clients just have this on hand. So because the weather comes in, it's foul, it kind of penetrates into the back. This is an aromatic formula that dries out the GI tract. So it can treat upper GI tract problems and lower GI. So here's a rudimentary image of a dog here. You say, well, we have the fragrant angelica and the perilla leaf and the fresh ginger and the Korean mint. Those are all those aromatic compounds in this that vent the pathogen, help open up that spine. And that's roughly where they act in the body. The fragrant angelica oftentimes used for the top of the head for headaches, and the perilla leaf vents the lung. Ginger, obviously, these act throughout the body, but ginger's great for the GI tract, and then Augustoche is great for that colon. Venting the Tai Yang, and you would be using a sedating method on these upper bladder points that expel wind, maybe clear out some inflammation from the lung. And bladder 40 is a key for this. If you're venting inflammation from the spine with bladder 40, this is a formula, and the pulse settles down. This is a key consideration for you. Sorry. All right. Downward movers, we've got Pinellia, we've got citrus, magnolia bark, and that Da Huang or rhubarb rhizome, and those moving qi downwards. Purging the yang ming. These are sedating mu points and sedating shu points. So you're going to clear out the zong fu point, lung 1, conception vessel, which is the alarm point for the stomach, and the bladder 25, the shu point for the large intestine there. Damp drainers, Fu Ling and Augustoche, white atractylodes. So if you're draining Tai Yin damp, again, lung 5 would be added in there because of that He Si point, its ability, its influence on the yin in the body. And spleen 9, another He Si point that is your chief. You think about lung 5 and spleen 9, those are the He Si points of the Tai Yin channels. So you're oftentimes combining those if you're looking to clear out edema and regulate the water passages. That's what draining damp's all about. So you have thoracolumbar pain, vomiting, or diarrhea. That's when, sudden turmoil disorder, when you come across that in the Chinese texts. That's the unfortunate situation where you're sitting on the toilet with a wastebasket in your hand. Lumbar pain, counter current flow of lung qi with dampness and phlegm. An exit entry point blockage. Okay, this is something that 5-element practitioners talk about quite a bit, but you have essentially the liver moving into the lung channel, right? So liver 14 cycle gate, that's the end of the whole cycle, and it has to move into lung 1. So these two organs have different functions from a 5-element perspective, right? With liver being much more about wood and expansion, and lung being much more about contraction and withdrawal. They are contiguous channels, but if there's a blockage between them, then sometimes you have to figure that out. In 5-element theory, they say, well, you probably pick that up by a surging pulse more in the liver position and a weaker pulse in the lung, because there's this obstruction. That's something that might key you into that. But of course, if you're not comfortable with pulse diagnosis, that's a tall order. You say, well, maybe it's about a lot of problems at 3 in the morning. So we'll talk about that in a second. But Shui Fu Zhu Yutang, or drive stasis out of the palace of blood, is one of those formulas that smooths this discrepancy of flow between the liver and the lung. So it says blockage between lung and liver. You can tonify both points to get qi moving, but this slide is a little incorrect. What you typically would do is you'd sedate liver 14 and you'd tonify lung 1 to get that congestion out of there. I was talking with one of my clients that's a practitioner, and she mentioned an interesting thing, and that she said that underwire bras will oftentimes inhibit the flow of energy from the liver to the lung. So, and it seems like it might be correlated with some stagnation syndromes there too. I thought that was very interesting. She uses a lot of thermography. Lung 1, Shui Fu Ziyutong. This formula, a lot of practitioners are very familiar with it because it's commonly used, but it just contains 4 materials, which is Si Wutong, and 4 qi movers in the San Ni San frigid extremities powder, and then it has a couple of additional blood movers in persica seed or peach seed and carthamus flower at the top there. So really it's all in and tonifying and moving blood. That's the point of that. And so you'd be thinking about this formula if you had some blood stagnation in the lung. Again, sort of this, I didn't have a chance to correct this. This would be sedating liver 14 most of the time, tonifying lung 1, and you might have restlessness at 3 in the morning, a chronic resonant cough, tracheomalacia, so collapsing trachea, cardiopulmonary disease, pulmonary adenocarcinoma, in humans tuberculosis, and then bilateral treatment of liver 14 and lung 1 is recommended. And it may be that only one side is blocked, and you may get some hints with some masses and things of that sort. You could also sedate the shu point, the liver shu point, and tonify the shu point of the lung. Yes?
There is a tumor on liver 14. You can't put the needle through it, so how do you try and sedate that point?
Yep. Well, if there's a tumor there, what you could do is you could needle, you know where the channel runs, you know where liver 13 is, so you could needle on the other side of that tumor, and you're sedating, so you're sort of pulling blood flow back away from that. That's a good question. The question was, I'm sorry, what if there's a tumor? I always forget to do that. What if there is a tumor on liver 14? What do you do? Well, instead of needling straight through the tumor, you could back away from that and needle closer to liver 13. A lot of Chinese practitioners do needle straight through tumors as well, but depending on the type of tumor and the blood flow, of course. Okay, this is a formula for excess of a different sort, and whenever you see this is a typo here. That's supposed to be T-A-N instead of T-A-N-G. Whenever you see Tan in the title, that's phlegm. So Qing Qi Hua Tan Wang is clear the qi in the and transform phlegm pill. So that P is supposed to be this green phlegm, and if you sedated all of these points, lung 5, lung 1, spleen 9, again you have that lung 5, spleen 9, Tai Yin, He Si point combination, and you have your quintessential phlegm moving point of stomach 40, you're all in with trying to move phlegm out of there. So cough is productive, worst in early morning. Again, so your lung qi is at full tide, a strong rolling pulse. Patient looks damp and often hot, and a sedating method moderates the pulse. This is going to be a rolling sort of full pulse that you're moderating. And this formula just has some of the usual suspects there when you're moving phlegm. This erythema with bile is Dan Nanjing, and scutularia or skull cap, Huang Qin, that clears heat and phlegm from the chest. Immature tangerine has a strong down-bearing action, citrus peel in there. So when you have 2 citruses, you know that you're really going after qi stagnation in there. Apricot seed, Ku Xing Ren is very good at relieving cough. Bansha and ginger, Bansha and Shengjian, that Pinellia and fresh ginger, that combination that shows up again and again in herbal medicine to alleviate phlegm. Middle Jiao signs, so this is sort of a review of lung 1, if you have the middle jiao signs, which again is sort of the number one use for this point, and you basically have some spleen qi deficiency, use air chen tong. If you have excess of dampness, heat, blood, phlegm, and food stagnation, yu zhuan. That's escape restraint pill. And then if you have some pain and wind associated with that, you're going to use that Augustoche compound. And in our practice, by far, we use this, because I like to say Augustoche in front of clients, pretty much. It's more versatile. It's really, what happens, what you realize is that there really is oftentimes a wind component with this stuff, that weather systems are coming in and that's more of an issue. Okay, if your upper jiao is a bit dry, shui fu zhu tong. If you're a bit damp, your patient's a bit damp, qing qi hua tan, not tong, tan wang, phlegm, heat, stagnation. Okay, and you oftentimes see more of that, more of the dryness. I'm sorry. Okay, moving on. So the lung channel topical geography, we had this hanging lake, if you will, which is lung 1, Zhongfu, and think about that evaporating up into the mountains. And that second point then is Yunmen, or cloud gate, that mist, and then it starts to condense. It starts to gradually start to come down this mountain, and so you have a high mountain stream. Tianfu is Palace of Heaven, clasping the white lung 4, and now you're down to this Highlands Marsh, okay? You have consolidation of fluid, and think about what's happening at lung 5 is that you can palpate this point in people to see what healthy glow is there. Is that a healthy amount of sebum? Is it an area of eczema? Is it inflamed? So that's kind of a tell, if you will. And you can also pick up the cubit pulse there. Not that it's commonly done, but you can feel the pulse there as well. So this is Chuzhi, and we have basically a demarcation between this heavenly influence in nature, ethereal, and now we're talking about lung 5 consolidation into more concrete waterways, lung 5 through 11. Ethically, heavenly inspired energy meets the rules of an earthly existence. So now some of the spiritual aspects of these points are going to relate to following the rules, or don't follow the rules so closely. Like, relax a little bit. You're a little tense. So He points prized, popular in, well, traditional Chinese medicine is the term. Some people are now sort of talking about classical Chinese medicine as of or relating more to some of this classical imagery. So in traditional Chinese medicine, in more of the communist era, these points, these transporting points, were very, very popular because it would allow for modesty. You could say, roll up your shirt sleeve, roll up your pant leg, and I can treat all of these transporting points. And so this was very useful. What are we talking about? Where's the location? On the transverse cubital crease, on the lateral side of the tendon of the biceps brachii with the elbow flexed. So Chur, derived from two characters for people and know. It means measure, cubit, norms, rule, law. This is where these pictographs have broad meanings. What people need to know to live as a society. So the lung is about executive order, norms, law, punitive, judges. That's all very metal, right? Very cut and dry. And so this point is oftentimes used to reorder that function in people. The distance from the tsun, that tsun pulse to the cubit pulse, is 10 tsun. So 1 chur is 10 tsun. A related term, guizhi, it means rules and regulations, and that is slang for not knowing right from wrong. So you can needle this point to improve that function in someone. The Dui trigram in the I Ching really talks about, this is the trigram for the lake in nature. And so, Zhe is an ancient word for lake in Chinese. marsh, low-lying, water accumulates here. Eczema, we talked about that. So it means greasy or glossy, and you can palpate here to assess that. Metaphysical uses of lung 5. Well, you're consolidating in the physical form and making it look glossy. So if a person maybe is a little shaky in their life and you're saying, hey, look, we're going to improve this feeling that you've got back to, you're getting back to solid ground. It can also be very good for laying down the law, giving a patient strong direction. So if you have, you think about the lung, the tiger, right, the Po, the awakening of the Po, bringing that heavenly inspiration into the corporeal soul, that's about awakening the senses, seeing, hearing, smelling in a much clearer way. It's like jolting you back to, I'm back, I'm here. The pathology, though, is that you sometimes, if you come across a patient that feels like they're a big fish in a little pond, they can maybe suffer from some arrogance, then you can use lung 5 to cool down the ego of someone who has an inflated sense of self, okay? But these Hussey points oftentimes clear out some heat, and so we see patients that are yin deficient that have a lot of lung phlegm, right? Because less commonly we'll see phlegm develop from an insufficiency of fluids, and things come to congestion, right? So this hot, dry shepherd might be stretching out its neck because it's got sort of stomach heat and lung heat phlegm. It's trying to address that, maybe agitated. Whereas you have maybe this bulldog here with more of a dampness and phlegm and lung phlegm heat constitution. Either way, you're still trying to draw out heat from both of those patients. So you would be sedating, but you would use supportive acupuncture to help you figure out the pattern, right? So you might be tonifying lung 9, which is the lung yuan source point, because that's going to tonify yin. And you're using kidney 3 to tonify yin, and you're tonifying bladder 43, because that oftentimes has some of the mental, emotional ramifications of this yin deficiency. Sedating kidney 6, which is the point for deficiency fire. Versus some of the points that we just talked about for lung 1. Lung 1, stomach 40, spleen 9, those clear out that dampness and phlegm. Oh boy. What I want you really, we're not going to go through this too much, but I put these up here because I wanted them to be included in the PowerPoints. Also, I just want you to realize that the Qing Qi Hua Tan Wang, the phlegm mover, is contrasted with the Qing Fei Tan, or clear the lung decoction, because you see this formula has Ophiopagon, asparagus, angelica, licorice, and schisandra, which is a sour astringent. So if you're really trying to bolster your yin, okay, like in that shepherd, you're using this formula. If you're trying to clear out that phlegm and dampness like in that bulldog, you're using this formula. All right. So pain along the channel, with carpal elbow or shoulder pain. If you have, I love this image. This one dog there on the right is like, I don't know this person. I don't know this guy. The other one's like, I'm the happy uncle that tells inappropriate jokes. So anyway, you have this combination of formulas, Hoxie and bone set formula with Simyasan, and that basically leaches out dampness from the body and moves circulation through these inflamed joints. So there may be sedating several He points to good effect. Gallbladder 34, you're going to be moving a lot of qi. Spleen 9, clearing damp heat. Large intestine 11. Bladder 40. Hoxie and bone set is sort of a who's who of Western alternative herbs rather. Artium, buckthorn. You know, we've got some nice ones in there that clear out inflammation and move circulation through there. The bone set's important if you want to have a musculoskeletal effect. And then you can combine that with Simyasan or Four Marbles because Four Marvels lends a little bit more support to the spleen. Here in Hoxie, we really only have licorice root, Stillingia drains a little bit of dampness, and poke root, no, poke root doesn't do much for you. So you sometimes need to improve spleen chi with another formula. And so Sumya-san is this pattern here, which is the nodes of acute inflammation with spleen chi deficiency leading to dampness, chi stagnation, and damp heat. And it's very simple in its construction how those 4 herbs clear out heat, move chi stagnation, and support the spleen and drain wind damp. So you'll see inflammation in the shoulder, the carpus, the elbow, the hip, the knee, the tarsus. You can combine Hoxie and bone set for better effect there. It's interesting to note that lung 5 actually has this ability to reduce pain in the lumbosacral area. That was one of the things that I came across that surprised me. And I oftentimes will modify Sumya-san with fungi, just a little bit because it tastes pretty bad, and turmeric and capillaris and clematis. If I've got a really static patient, a lot of pain, these herbs bring an anti-inflammatory effect to that. Psychiatric uses of lung 5. All right, Wen Dan Tong is warm the gallbladder channel, but there's nothing warming about it. And oftentimes it's modified with Huang Lian, golden thread, or coptis to address heart fire. And so it looks very similar to some of the herbal formulas we've been talking about, like Air Chen Tong, but it has some bamboo in there, and it has some down-bearing citrus, that immature citrus. And so you add in that coptis, and you really start to clear out some heat and calm that patient down. So if there are respiratory and GI signs and symptoms, you're sedating lung 1, stomach 40, bladder 21, and conception vessel 12. You're pulling qi and yang and yin away from that stomach. All right, now we're moving on to lung 7, or Liu Chu, broken sequence. And you can see that the channel takes a little bit of a jog here. And that oftentimes happens at points that connect, the luo connecting points with other channels. There's a bit of a zag there. But that has an interesting part of the nomenclature, which we'll see here in just a moment. It's location, proximal to the styloid process of the radius, 1.5 tun above the transverse crease of the carpus. And the character here is an archaic word for lightning or the thunder god. And so you can see how this point, that jog over there, resembles a lightning bolt. It's the low connecting point of the lung channel. It's the confluent point of the conception vessel. And it's a Ma Dong Yang heavenly star point. Ma Dong Yang was a physician in the Ming Dynasty, and he basically came up with 11 very important acupuncture points, a lot of them Hussey points and connecting and source points, and then one more was added, liver 3, to make it 12. So we just kind of sort of highlight those because they're commonly used. So what you also see a knife radical in this character, and you see a radical for a clay vessel and a cut into that, making a hole. So it's basically a way of saying to make imperfect, okay? So destroying wholeness, making less than perfect. And there's that duality to that point. It could be that you help a person that is so perfect dance out of line. Or you could help someone that needs to get in better order shape up. Making disorder out of order, or the opposite. It's a point used to shock someone into sharper consciousness with the powerful jolt of a thunderbolt ripping through the sky. Or alternately, to mellow someone out, right, like we just talked about. And it's a great point to reinforce the downward action of the large intestine to purge one who is literally anal retentive, okay, stuck on order. So it's used sometimes actually to help with constipation, but it's used in sort of a mental, spiritual way as well. And the indications, it's really interesting how lung 7 is so intimately tied to the large intestine. Its functions really tie in closely with that channel. Okay, so it's a point used to reinforce the metal. So think about the value of gold, silver, and restoring of self-worth. Open up space between heaven and earth, kind of like a thunderbolt does. Good point to treat claustrophobia. Engenders a feeling of wide open space. And one of 100 points mentioned in the Nei Jing. If you're deficient here, a patient will yawn and urinate frequently. So sort of a key to being deficient. Often treating the up-down lung function, acid reflux, hypertension, anxiety, headache, hot flashes, etc. Physical uses of the point: releases the exterior to expel wind, benefits the head and nape of the neck. It's the master point of the head and nape. You think about that. If large intestine 4 is the master point of the face, then, and lung 7 is the master point of the head and nape, lung 7 is on a channel that doesn't even go up to the head. It travels through the large intestine channel and the stomach channel and connects into the conception vessel through that. This is pretty interesting. You have to understand all the connections of the channels to be treating this to address the nape. Pacifies wind and phlegm, opens the conception vessel and regulates water passageways. So if we have kitty cat here that is susceptible to both a wind-cold invasion of the tai yin, the lungs, and a wind-cold invasion of the tai yang, the neck, the nape, and you basically sedate lung 7 and tonify large intestine 4, what you're doing is you're pulling out energy from the excess of the lung channel and you're putting it into large intestine 4 to expand the Wei Qi defenses that large intestine 4 can achieve. So historically, they might be averse to wind. They might have a headache, so squinting, aversion to being petted on the head. There's some neck and thoracic pain, mild fever, sore throat, cough and wheezing, nasoocular discharge of an acute nature, and often this is a little itty bitty kitty, so more a thinner, frail cat that doesn't have a large amount of Wei Qi. Okay. So the tongue may be lavender with reddish hues, but usually is a bit smaller, suggesting that sort of qi and yin deficiency. Pulses are thinner and floating, reflecting conflict with the shu qi, the pathogenic qi. So that's one of those superficial pulses, and that superficial pulse is caused by this pathogenic entry into that dorsum there. Acupuncture results are often appreciated immediately because you release that congestion from the tai yang. All right? And so the herbal formula that reinforces that is guizhitong, cinnamon twig decoction. This is used a lot in people that maybe can't fend off a cold wind and get a lot of pain in their neck. But it has cinnamon twig and white peony, another pair of aces, these herbs that work very well together because peony is more of an astringent and a mover, I should say a yin tonic, where cinnamon twig is more of a diaphoretic and an opener, and they regulate to control the pores, to vent the pathogen, but not open things up so much that you let more pathogenic entry come in. And they're also very spasmolytic pairing there. And then you have licorice and peony, a great pairing to reduce spasm. If the neck is really tight, you've got all this muscle spasm in the back of your neck that responds very well to that. And then ginger and Chinese date round that up. So wind heat turning to wind cold. the acupuncture for Guizhitong, this is now we're moving on to something with a little bit more heat involved. And there's nasal congestion with yellow or green discharge, which connotes that there's heat, increased respiratory effort, fever, oftentimes a higher fever. So you're thinking about more of like a viral etiology of upper respiratory infection, pain along the neck, thorax, and lower back, and a stronger high floating pulse. So with wind heat, that pulse is going to be stronger than with wind cold, okay? And you're going to have, instead of maybe a low-grade fever or no fever at all, now you have more of a fever to deal with. And oftentimes a history of being an excessive cat, okay, so, or an excessive patient, maybe eating a diet that predisposes them to a little bit more inflammation. So wind cold invasion turning into wind heat, and this is a cat that we saw 2 weeks ago with this condition. This is Freya. And mulberry leaf and chrysanthemum, we're talking about the formula Songju Yin, mulberry leaf and chrysanthemum decoction, which has these venting, cooling herbs in it. Mulberry leaf, great for the eyes, as is chrysanthemum, a little bit of mint, and then forsythia, which has a strong antibiotic action. Platycodon, which guides to the chest. Apricot seed, which reduces cough. And Phragmata lugen, which clears lung heat and generates fluid, and a little bit of licorice to moderate those tastes. Wind heat affecting the eyes, nose, upper respiratory tract, or wheeze. So Wuzhu Tong, active back in the 18th century, basically came up with Wenbing or warm febrile disease theory, kind of at the time when Chinese medicine was really noting that, okay, we've got these microorganisms that are causing a problem in these epidemics. And he came up with Yin Chalsan, or honeysuckle and forsythia powder. And basically, these herbs are a little bit more cooling. This formula is a little bit more cooling than the one we just discussed if there's even more heat. So honeysuckle, forsythia, arctium, bamboo leaves, and phragmata in there. And there are commercial preparations that actually combine Songju Yin with Yin Chalsan to take in the early signs of a upper respiratory tract. But basically, the acupuncture is in treating lung 7 in that bladder 12. You know, bladder 12 connects with the large intestine channel, which we'll see here in just a moment, and it really vents those pathogens from that upper neck area. If you have neck and thoracic pain in more abundance than just these upper respiratory signs, then you're thinking about a formula called Zhai Wei Chai Gu Zhejitong, which is bupleurum and kudzu clearing formula. And this is a great formula because it has these herbs that really release the Taiyang very effectively. So you have Baizhe that we've seen before, that fragrant angelica, Gugen, kudzu root, and Qinghuo notopterygium really relieve a lot of spasm in that neck. Chai Hu is a general wind expellant, and Du Ho is present in some commercial preparations to extend this anti-inflammatory action from the neck down into the lower body. So bladder 12, but maybe you're again keen on bladder 40 like you did with Agastache, but this time this is really more about neck and back pain and less about GI signs. Small intestine 3, which I'll hopefully get to later today, that's about the Dumai, right? That's about the inflammation right along that spine there. So we have pain relieving and taste moderating herbs like white peony and dried ginger, and heat clearance, huangqin and shugao, or skullcap and gypsum. And we have a couple of directional herbs, the platycodon, I should say, just one that guides to the lung, and then harmonizers, Chinese date and licorice root to moderate. These are pretty bitter herbs in here, right? So If you're giving this formula, sometimes a encapsulated form or a tableted form is best. All right. Pacifies internal wind and phlegm. And so we have basically, it's interesting how lung 7 is again, talking about treating facial paralysis and hemiparesis, lockjaw, epilepsy, toothache, headache, but it doesn't travel up to the head, right? It does all of this through this large intestine channel. Main indications for the Ma Dong Yang's Heavenly Star Point. We have this little pug dog here, and they're renowned for getting facial hemiparesis, basically. We can use the formula Ban Sha Bai Zhu Tian Ma Tong in these little damp phlegmsters to clear out some of the phlegm in there. So we have basically the elements of air chen tong, the 2 cured herbs decoction, with some of these wind expellents. So if we look at this, we're tonifying bladder 20 to indicate that this formula is not such a bad choice because we have all of these chi tonics in there. The atractylodes, the astragalus, and the ginseng are classically known, but then we have sprouted barley and fermented leaven again, which is what Master Li, the sort of the founder of the spleen school of Chinese medicine, added in to improve the digestion of that formula. And then we have basically sort of damp heat clearing pairing, that is air miao san or 2 marvels decoction, tung zhu and huang bo in there. And we have basically fuling and emporia rather, and elisma, which help to regulate the water passageways and clear out edema. And that Pinellia and citrus peel move phlegm. And then, of course, we have Gastrodia Tianma, and it could be modified with a little bit of silkworm to get into the stomach. All right, that's time for a break, and we'll continue on with the lung.
Finding your visibility in today's climate with website creation, hosting, SEO and social media management, telephone greetings and VoIP services, and online video production.